At Guidelight, we take a community-centered approach to mental health care. This model fundamentally changes the client journey by preventing unnecessary emergency room visits and hospitalizations. What we see happening in many communities is the ED has taken a prominent role in the continuum. It was never meant to be that way. But there's trouble accessing intermediate levels of care all across the country. This leads to people presenting in a crisis at their ED, then they end up in the highest level of care, which is inpatient. They're often stepped down to a PHP that is not typically well-resourced, and they go through the program without getting better. Then, they're not properly transitioned to longitudinal outpatient care, and they end up re-presenting in emergency rooms in another crisis, starting the cycle all over again. At Guidelight, we intervene by building deep relationships with outpatient providers so that we can be a high-quality and very accessible option for individuals who need additional support. This also benefits providers by reducing burnout. We work with them to stabilize their clients who need extra care so they can successfully return to individual therapy as soon as they are ready. What I really love about PHP and IOP programs is that because they are heavily focused on skills work, they're a great complement to other levels of care, like inpatient, in the sense that inpatient is more about stabilizing the patient so that they get a solid foundation and then begin the skills work. And outpatient in the sense that an individual spends a lot of time developing and working on skills with Guidelight and then transitions back to their longitudinal provider to re-engage with more psychotherapy. Good transitions in care are a key to each level of care building from the previous one. And this is where communication becomes imperative. And it is also what makes outcomes last beyond just an episode of care. At Guidelight, we're not just another step in the journey. We're a bridge to recovery, offering compassionate, evidence-based care that actually helps clients improve. To learn more or make a referral, contact us today. Let's work together to improve the client journey.